A very good afternoon to one and all. I wish you all a happy World Physiotherapy Day. Today we are here for the webinar on the topic Direct Access in Physiotherapy, a Dream Come True. The resource person is Dr. D. Thiagarajan. The moderator for today is Dr. Subhashini. We are live on IIP India YouTube channel for this webinar. I request all to subscribe to this channel to get regular notification of live webinars. We also have our IAP profiles on other social media, Facebook, Instagram, Twitter, LinkedIn. I'll be sharing the links for this profile in the chat shortly. In the YouTube, we have playlist sections on different subjects for easy referral to our previously live streamed webinars. Now I request Dr. Subhashni to please take over.
Thank you, ma'am. It is my great pleasure to introduce Dr. D. Thiagarajan, Principal and Head of the Department of Physiotherapy at Tagore College of Physiotherapy and Tagore College of Physiotherapy, Tagore Medical College and Hospitals, Chennai. Dr. Thiagarajan is a highly respected academician, clinician, and researcher and mentor with over 24 years of experience in the field of physiotherapy. He has also served as a principal and head of department at Santosh Deemed University, NCR, New Delhi. He is a renowned resource person and course instructor in both musculoskeletal and neurological physiotherapy, having trained and guided countless budding physiotherapists. His remarkable contributions have been recognized through 6 prestigious national and international awards, including honors from the Indian Association of Physiotherapists. Dr. Thiagarajan has conducted numerous workshops, notably like 14 on motor learning program on stroke, Bernstrom approach, 4 on motor releasing program, 19 on athletic approach, 4 on dysphagia management, and 17 on myofascial trigger therapy. He has also presented over 50 papers at national and international conferences and has published more than 10 research articles in Scopus and UGC Index journals. We are truly honored to have such a distinguished academician and clinician with us today. We warmly welcome you, sir. Over to you, sir. Thank you.
Good afternoon and all. Am I audible? Subhashini ma'am, am I audible?
Yes, sir. Yes, sir. You are audible.
Yes. Can I start?
Please, sir. Please.
My screen is live.
Yes, yes.
Are you able to see my screen?
Yes, sir.
Right. Okay.
This Ganesh.
So it's a good.
This Ganesha is there. That is the screen, no, sir?
Yes, yes, yes.
Okay, sir.
With blessings of Lord Ganesha, we'll start the session. So I'm Thiagarajan from Chennai. My best wishes to every physios across the globe. So today is World Physiotherapy Day, 8th September. So it's a proud and pride moment for all of us, to celebrate this day with great joy and pledge. You should know why this World Physiotherapy, how it has started. Actually, this World Physiotherapy Day, the September 8th, was established in 1996. This day was started celebrating since 1996. Why they selected September 8 means World Confederation of Physical Therapy was founded in September 8th in 1951. So, the World Confederation of Physical Therapy founded day was September 8, which was later started celebrating World Physiotherapy Day in the same September 8th from 1996. This day is utilized for creating awareness among public and healthcare professionals There is a small contribution of myself to the field. I got significant contribution award by Indian Association of Physiotherapists in Goa in 2013 and by AIMS New Delhi in 2013 and Scroll of Honor Award by Savita University in Chennai. Then significant contribution award at second state level conference in Pune, and then significant achievement award by IAP during 2020 and transformational leadership award by Madras Medical Mission in in 2024. And I got patent as a single investigator. I have developed a device called a posture training device, which can be used to train posture. So I got patent from Indian government. So this is my 25th year of clinical practice, clinical, academic, and research. So I'm into 25 years of practice. My topic of presentation is direct access in physiotherapy. A dream comes true. Ma'am, am I audible? Subhashini ma'am, am I audible?
Yes, sir, you are audible.
Okay. So the topic is direct access in physiotherapy, a dream comes true. So why I have kept a emblem here, valuable 25 years of experience means this direct access. For the past 25 years, I am having a first contact practice. I mean, patients will directly approach me for their problems, musculoskeletal or whatever it may be. I assess, I diagnose, I treat without any referral from any medicos. Till date, I didn't get any referral from any doctors. I haven't approached. I didn't approach till date any doctors, including my third house doctor friend or a next street, my uncle who is a general surgeon for past 40 years, and my cousin brother who is a orthopedic surgeon, and another one is an anesthetist. So I have never asked any referral for my clinic or for physiotherapy till date. So patients will directly approach a physiotherapist. That is called direct access, what I am practicing for past 25 years. How the physiotherapy has evolved in 460 BC, Hippocrates has emphasized exercises to increase physical strength, and in the same year, Greece, Hector, a physician, introduced hydrotherapy. 180 BC, Romans adopted a form of exercise known as gymnastics. So these exercises, which is the fundamental of physiotherapy, has been practiced, promoted 1,000 years back. So almost in the 460 BC or 180 BC, the concept as evolution. In 1723, Nicolas Andri, who was a professor at medical faculty in Paris, established the fact that exercising can help building muscles, especially in the arms and legs. In 1813, Per Henrik Ling, he developed a set of exercises called Swedish exercises. In 1864, Gustav Zander, a Swedish doctor, invented exercise machines to help the patients in performing exercises. In 1894, a group of 4 nurses in Great Britain formed the Chartered Society of Physiotherapy. In 1913, the School of Physiotherapy was established at the University of Otago in New Zealand, and during 1914, Reed College was established in Portland in the United States of America to educate about the reconstitution aids. So formerly physiotherapists were called reconstitution aids. During First World War in 1917, Americans used Zander's machine and Ling's Swedish movement to treat injured soldiers during war. In 1920, an outbreak of polio led to a greater need for improvising the existing techniques of physiotherapy. And Mary Macmillan is recognized as the mother of physical therapy for her instrumental role in establishing the field in the United States. She was the founder of first president of the American Women's Physical Therapeutic Association. Now it is known as APTA, American Physical Therapy Association. Actually, it was a Women's Physical Therapy Association, which was renamed and recoined as American Physical Therapy Association in 1921, and a trailblazer who significantly contributed to the development of physical therapy during and after World War. And this Mary Macmillan was a remarkable professional who led the profession to the next level. During Second World War between 1935 to 1945, special PT clinics were established to treat injured soldiers. In 1950, PT was performed in hospitals only. However, it was only in the late 1950 that PT was practiced outside the hospitals. By 1974, APTA established a specialized division known as orthopedic section for the therapists who were specialized in orthopedic physiotherapy. In 1980, due to the advent of computers in the healthcare industry, devices such as electrical stimulators, IFT, etc., were introduced to perform physiotherapy. So, 1980s, the electrical modalities, that is, electrotherapy chapter was opened in physiotherapy. In India, physiotherapy was officially established in 1952 following the Mumbai polio epidemic, with the first physiotherapy school founded in Mumbai in 1953. In 1962, the Indian Association of Physiotherapists was formed to further develop the profession. So this was the long journey of physiotherapy. Initially, physiotherapy was conceptualized, evolutionized in the form of exercise. They were trained technicians for giving exercises. Outbreak of polio and World War. These were the two scenarios where the physiotherapy profession has evolved in many phases and reached great heights right now. World War treatment of paralyzed soldiers was very troublesome and it was the need of the hour. So physiotherapy was given more importance in those World War period. Initially, the physiotherapists were called technicians. They were educated for 6 months. Then later, they were renamed or promoted or become therapists with 3.5 years, then 4.5 years of graduate degree. Now they become therapy doctor. The graduation will be of 5 years. In some countries, it is 6 years. It differs. In some countries, they have started a course called a doctorate in physiotherapy, that is DPT, not diploma in physiotherapy, which was called earlier in our places. Now it is doctorate in physiotherapy, is DPT, which is available in US and few Canada, etc. In India, now from 4.5 years, now we have moved into 4 plus 1, 5 years with a doctor prefix and a suffix with PT. So from exercise technician, from a massage person, so now we reached a stage called therapy doctor after a long struggle. Coming to my topic, what is direct access to physiotherapy or physical therapy? It means the patient will directly reach a physiotherapist for his shoulder pain, for his knee pain, or for his weakness in limbs, or for an ergonomic advice, or for a therapeutic management of asthma or COPD, or for a sports injury, or enhancing his sports performance. So wherever there is a role for a physiotherapist, wherever there is a need, the patient themselves will directly refer or themselves they will approach the physio for assessment, treatment, or any consultation. This is called a direct access. It is called a self-referral. Patient referring self to a physiotherapist is called self-referral or direct access to physical therapy. But previously, what people used to do, people first, the public will go to a general physician or to a orthopedic surgeon. From there, he will be referred to physiotherapy. Then the patient will come for physiotherapy as a referred client, which is called a referral practice. It is called referral practice. So patient will be referred by some other professional to physiotherapy. So it is called referral practice. Direct act in few countries, UK, public will first reach the general physician. General physician will decide whether the patient has to be managed with medicines alone on his capacity, or else he will refer the client to a orthopedician or a neurologist. From orthopedician or from a neurologist or from any specialist, the patient will be referred to physiotherapy. So this is called referral practice. Direct access means patient will directly come to you and will say their problems. You will assess, you will find a solution, and you will treat and you will give results if the patient or the condition is within the limits of physiotherapy. Otherwise, you have to immediately refer the patient, the concerned specialist, or to his family doctor. So direct access to physiotherapy, the patient or client directly asks the physical therapist to provide services. The patient refers themselves, and the physical therapist assess, diagnose, treat, and teach how to manage the pain and disability. What are the benefits of direct access? If a patient comes directly to you, first is cost effective. So he can avoid spending amount in hospitals or to or consulting a orthopedician. These direct access is especially important in orthopedic physical therapy. That too, to be very specific, in orthopedic physical therapy, if patient is not having any fracture or not having any infection, then the patient can be very well treated with physiotherapy alone. If the patient is having fracture, as we all know, post-fracture rehabilitation, they can come. If the patient is having infections, then they have to go for a conservative or surgical management for treating the infection. Then the patient will come for physiotherapy if it is needed. Apart from acute phase of fracture and infection, every orthopedic patient, musculoskeletal injuries, can be treated with physiotherapy directly without any medicines or with support of some medicines if it is necessary. So it is very cost effective. Studies show that the direct access can reduce overall healthcare costs by lowering the number of physical therapy session visits and overall healthcare expenses compared to physician first models. Time and convenience. It eliminates the waiting time for a doctor's appointment, allowing you to receive care and begin your recovery faster. Sorry. See, in India, approaching a doctor, getting a doctor appointment is very easy. But in Western countries, you can't get appointment of an orthopedician or even a general physician as easily. It will take time. You can't meet the same day when you get your neck pain or knee pain. Unless or otherwise, if the medical emergency, you will not be provided with any doctor's appointment. You have to wait for minimum 3 days or 1 week or more than that to get a doctor appointment. If the doctor appointment is getting delayed, then the problem may worsen, or the golden period of therapy will be missed, or the patient has to suffer for 1 week. Then the patient will reach the doctor, then doctor will refer the patient to physiotherapist. So time is very huge and the sufferings is very huge. So time and convenience matters a lot when it comes for pain and paralysis. Improved outcomes. Direct access is associated with better functional outcomes and higher patient satisfaction with their care. So the direct patient, those who are coming directly to a physio, he has his own choice. Instead of giving IFT for 5 days or 3 days or short wave for 5 days or 3 days and shoulder mobilization exercises, or traction. Nowadays, it's this. I have seen some prescriptions saying IFT for 10 minutes over lower lumbar region or L4, L5, or saying intermittent cervical traction 7 kg, 10 minutes. They are prescribing the parameters, the worst case, but most of the time, the prescription given by medicos is not at all suitable for physiotherapy. Because medical diagnosis is totally different from therapeutic diagnosis. Therapeutic diagnosis is uh, it is based on the target tissue. It is based on the source of problem. But medical diagnosis is based on symptoms. So that is the major difference between therapeutic diagnosis and medical diagnosis. That's why medical diagnosis prescription is not suitable for therapy. Improved empowerment. It empowers patients to take a more active role in their healthcare decisions and helps physical therapists operate at the top of their license. So these are a few benefits, important benefits of direct access. These benefits have been explained not after a thorough understanding and by various studies done by the physios and the agencies to prove that there is a benefit of accessing the physios directly without any referral. So there are a few reasons for direct access to physical therapy. It was explained by American Physical Therapy Association, APTA, from Michigan. They clearly agreed, understood, and authorized that direct access is cost effective. They say seeing a physical therapist first had a significant impact on and utilization rates. It is estimated that allowing for direct access, the patient saves an average of $1,500 to $1,800 per episode of care. So they proved that it is cost effective. Am I audible?
Yes, sir. Yes, sir.
So my screen is visible.
Yes, sir.
If anything goes wrong, please immediately alert me.
Sure, sir. Sure, sir.
Okay. So it reduces the risk of long-term opioid use. If physiotherapy is started early and if it is going on in this protocol based, so there is less use of painkillers and opioid use, which can prevent unnecessary complications of systems, organs, etc. Individuals receiving care from a physical therapist first for musculoskeletal complaints were 73% less likely to be dependent on opioids. So study says that there is a chance of reducing or even eliminating opioid use. It improves health outcomes and lessens disability. Early care from physical therapy following an acute onset of back pain with sciatica resulted in greater improvement in disability and secondary health outcomes. It reduces utilization of specialty services. Participating in direct access physical therapy significantly reduces the need for referral of specialty services, including imaging procedures and medications. So even if, see, because we go for special tests and we previously I told you, I used a term therapeutic diagnosis. Therapeutic diagnosis is a tissue-based diagnosis, source of problem-based diagnosis. It is not symptom-based diagnosis. Since it is a target tissue-based, source-based diagnosis, we are able to understand or we are able to find out the target tissue which is under dysfunction. So this reduces the need for imaging procedures and unnecessary medications or investigations. But for safety purpose, if you have a doubt, if you are getting a doubt while assessing a patient, it is always good to have a minimum diagnostic, minimum investigation like X-ray. as safe as seeing a physician first. Multiple studies highlight the ability of physical therapists to safely triage patients with musculoskeletal complaints and make appropriate and timely referrals as needed. So it is safe. Most of the patients used to ask, can we see directly a physiotherapist? Or else I have to visit any doctor and bring the prescription to physiotherapist to take treatment. Here we have to be very humble, polite, and careful to say that there is no need to get a referral. You can directly approach a physiotherapist. He will assess if will be treated with physiotherapy, then he will start. Otherwise, he will refer you to concern specialist for further management. So we should know our boundaries. Based on our professional boundary, if the patient is suitable for physiotherapy, if he can be treated, managed with physiotherapy alone, then we should commit. Otherwise, we should refer the patient to concerned specialist. So these are the 5 important benefits found after various studies performed in various countries explained by American Physical Therapists Association, Michigan. So as I told you, there are some studies. There is a systematic review of effectiveness and consequences of direct access and physiotherapy by the clients. This study concluded that yes, direct access to physiotherapist, the benefits as mentioned earlier, like it saves time and it is very convenient, it is cost effective, it is safe, and it is out. The results are awesome. So there is no doubt, direct access in physiotherapy is very, very, very essential and important in healthcare delivery. So now, if patient comes directly to us, it is called direct access. If we take patients directly, if we assess, if we diagnose, if we treat, if we give results, then it is called first contact practice. It is called first contact practice. If we practice by seeing a prescription, by getting a prescription or getting a referral from a doctor, then we are secondary practitioners or we are referral practitioners. If you want to become a first contact practitioners, then the patient should approach you directly and for getting treated without any medical consultation or any medical prescription. This is called first contact practice. During the year 1970, Miss Galley, she was very, very, very precious physiotherapist in America, had a wonderful, amazing vision of physiotherapists becoming first contact practitioners. She was the first lady who explained, initiated, acknowledged the importance of becoming a first contact practitioner in a healthcare delivery system. So she fought for professional autonomy that led to physiotherapists being able to practice independently in due course. She was awarded with Lifetime Achievement Award by Chartered Society of Physiotherapists in UK. Residents in New York can go directly to a physical therapist without being required by law to obtain a prescription from your medical doctor. And the law was passed in November 23 in 2006. So they have a limit, 10 visits or for a period of 30 days, whichever occurs first, a physiotherapist can treat a patient. Physical therapists need to have 3 years of practice experience to provide direct access services. Not after completing your undergraduation, you cannot or you may not be a first contact practitioner. Definitely, you should have 3 years of experience to become a first contact practitioner, or the patient can directly access you for your services. The pathetic scenario is students, those who are studying in third year, second year, started seeing house visits, they started seeing patients, treating patients in home, and it is very pathetic situation where I have seen in many places in India. In every state, this is one important problem where the students approached by the therapist or by a medico to do house visits, to treat patients in clinics, either therapist giving a chance for some benefit or the student himself volunteering to start treating patients in home and in clinics during studentship. It is very pathetic. World Confederation of Physical Therapy, WCPT, physical therapy professional entry-level education requires physical therapists to be first contact autonomous practitioners able to assess, examine, evaluate, diagnose, treat, intervene, evaluate outcomes, and discharge patients, clients without referral from another healthcare professional, especially medical practitioner or any other third party. So this was the statement given by World Confederation of Physical Therapy. What are the benefits of first contact? But there are some benefits of first contact practice, as we mentioned earlier, was cost effectiveness, less time consumption, quick access to physiotherapy. Physicians and surgeons can spend their precious time in most difficult medical emergencies and research instead of checking ordinary ligament injuries or muscle injuries and arthritis, etc. Instead of wasting time in these conservative cases, physicians and surgeons can spend their precious time in most medical emergencies. What are the disastrous effects of direct access? We are expecting, or we are willing, or we are having a desire to become a first contact practitioners, or the public should access the physiotherapist directly without any medical referral. Of course, there are a lot of benefits, but I think there may be some side effects of disaster effects of direct access. If therapist is not competitive, if he doesn't have any commitment or not having any knowledge and skill, do you think that the direct access will give you the fruitful result? No. It may result in provocation of injury, or it may result in permanent tissue damage, which will lead to impairment or sometimes disability. Economic burden. So coming to physiotherapy, it's a costlier affair. It's not easy to take therapy for 50 rupees or 100 rupees. Though government setups and trusts are giving physiotherapy services free of cost or with minimum charges, most of us, the clinic or hospital, it is chargeable, but there is no harm in it. Of course, if you provide a service, you cannot expect everything is free. Nothing is free in this world. Everything has its own value, cost, and respect. The same, every professional charges having its own respect and and physical and emotional trauma. This direct access sometimes results in physical or emotional trauma to patients and nowadays sometimes to therapists also. And damage to fellow physios. Here, one important point I have to mention: whenever patient comes to you, while collecting history, if patient says that he or she has been taken treatment by from your fellow physios anywhere in India or anywhere in the world, please don't uh, give disrespectful comments by saying the diagnosis is wrong, treatment is wrong, he doesn't know anything, this treatment is not effective, nothing. So behave very professionally, follow professional ethics, and make sure that you are not criticizing or insulting or degrading the fellow physio. Naturally, it is a damage for profession. So it is not a good ethical practice, whether the patient got improvement or not, whether diagnosis is right or wrong, you don't utter a single word regarding the previous treatment, prescriptions, etc. It is always better to speak what it is available now and what will be done and what will be the result, instead of blaming the previous physios, those who have treated them. Not only physios, better keep quiet regarding the medical diagnosis. If it is asked, doctor, can I take this medicine? Then you say, you have to ask the person who has prescribed it. You don't say a single word, that will land up in many troubles between the medical practitioners and physios because of patients' immaturity or, uh, or lack of loyalty, you can say. They will put all the blame on you, and they will say to a doctor that the physiotherapist told that these medicines are waste, or this will spoil the kidney, etc., etc. It is none of our business to comment others prescription, especially a medical prescription, that too on pharmacology, that is medicines, because we are nowhere connected to it. Then lack of experience on that particular condition. See, 1.5 months back, one uh, parents came with their son, 1.5 years old son. The parent asked me, "Sir, do you have experience with this treating this?" I told, "Yeah, I'm having 25 years of experience. You're asking me a funny question." Then the mother of the child clearly asked, "Sir, you may have 25 years of experience, but our question is, our worry is, our requirement is, do you have any experience in treating developmental delay of a child? In that experience, in that capacity, can you treat this child? Can you say for the improvement, or what will be the future of this child in terms of mobility and activities of daily living?" Like that, first contact practice or direct practice is not at all easy. Direct access is not at all easy as you like. Lack of infrastructure. Most of the clinics, they doesn't have proper infrastructure. See, there was a recent trend in this decade. Most of the manipulative therapists or orthopedic therapists used to say, "I don't need any equipments. I need just a couch. My hands are having all the types of electrotherapy, etc." But in few areas, in few occasions, you may do wonders with your hands by giving manipulation or soft tissue release or stretch or whatever it may be. But out of my 25 years of clinical experience, teaching experience, and academic experience, I I confidently say, electrotherapy, you cannot neglect. You cannot treat a patient, all the patients, especially, you cannot treat all the patients, especially with your hands and fingers. Definitely, there are some conditions Example, you take acute lumbosacral strain or a paraspinal muscle spasm. In acute spasm or an acute strain, you can't do much with your hands and fingers. There you need an electrotherapy machine or something else to reduce the inflammation or to control the inflammation in the injured region. For that, definitely we need some electrotherapy equipments or something else to do. So experimentation, lack of next is experimentation. When the patient comes as direct access, don't do any experimentation. Please avoid overconfidence. I am seeing in social media the fellow physios, those who completed 1 year back, 2 years back, 3 years back, they started challenging the professionals, saying that I can treat any type of patient. I can give results within 1 day or 3 days. There is waste of spending time in physiotherapy for weeks together. So these type of overconfidence will spoil the show and it will spoil the profession in due course. Money making, of course, make sure that you are not making much or more or unnecessary or higher amounts in the name of practice. Of course, we should charge, but make sure that the charge is now the charge is coming not only from your brain, it is also from your heart before taking from patients. If you give excellent service in excellent infrastructure with excellent charge is not a matter here. Otherwise, you have to think egoism, professional limits, and boundary of practice. These professional limits, especially now for past few months, medicos are having very good rapport and they want to have rapport with physios. Of late, I realized and recognized that now medicos are giving very good importance to physiotherapists, but make sure that we are not taking advantage or we are not allowing them to take advantage at this current junction. Who spoils the show? Mostly few of our fellow physios through incompetent, illegal, unethical ways. They are spoiling the professional name than the other fellow healthcare professionals. 160 physios were practicing medicine in one metro city. Their secret survey was done by NCA, that is previously it is NCA, now it is National Medical Council and Indian Medical Association as having a list of people, those who are practicing medicine. I can say in my area, one physiotherapist since 15 years, he is writing only medicines for patients and he is writing a prescription, entire prescription. He is writing a painkiller, antacid, calcium tablet, vitamin tablet, mineral, etc. And finally, he is writing shoulder IFT for 5 days. So he himself writes, he himself gives all the medicine and he writes 5 days physio. That is IFT for 5 days. So this is the status of physios. There is something called extended scope practitioners. After doing bridging course, which gives exposure in pharmacology, not all physios would get the right to prescribe medication. Physiotherapists would have to undergo a training course and be approved before being allowed to be an independent prescriber. This is really only for experienced physios who are specialists. The minimum they need 10 years of clinical experience to become extended scope practitioners. Extended scope practitioners first was introduced by London. So in London, physiotherapists have been the people, the physios, those who are having more than 10 years of clinical experience are called for getting the title called extended scope practitioners, where they undergo bridging course in pharmacology and they will be prescribing painkillers and certain drugs to patients without any medical supervision or referral. So they are called extended scope practitioners. So this was the landmark decision gives UK Physios a world first in prescribing rights in 24 July 2012, BBC News, UK, the announcements were made. UK physiotherapists have won a long fought battle to be able to improve their patients' care by prescribing them medicines without needing a doctor to sign off their decision. USA, Canada, European countries started going for first contract practice and extended scope practitioners, the next level, the higher level of physiotherapy practice. First contact practice is not as easy as you understand. It is very, very, very difficult because you are the person going to diagnose, you are the person going to prescribe the therapy, and you are going to give therapy, and you are going to take results. So the entire burden is on you to give results to your patients. That's why I'm saying first contact practice is very, very, very tough and important now. For that, you need knowledge and skill. It is mandatory. Society demands. Now public is very aware. The public started medical shopping. They go for clinics to find who is good and which infrastructure is good. The media and internet exposure is a double-edged arrow. It may harm you. So we should be very careful in handling media and internet exposure. That is social media and internet exposure. Professional competition is huge. So survival of the fittest. If you don't have knowledge and skill, you cannot survive. You cannot cheat people, public or the fellow physios for a long time without giving results. You cannot survive. So for giving results, you need knowledge and skill to get the result. Extreme curiosity. Enthusiasm and urgency matters a lot now. Don't keep business point motive in practice. Survival of the fittest is the only option. Infrastructure should be very, 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 very effective, constructive, creative, and well hygienic and in a pleasant atmosphere. Patient comfortability is very, very important. Publicity, mouth to mouth, you can go for flex boards, referrals, media, regional network, pamphlets and brochures, publishing articles, internet, website, advertisement sites, Facebook, which is a viral mode of transforming information. Here in this slide, I want to request all my fellow physios, please don't give any prescription pad to doctors showing your clinic name and the facilities available like IFT, ultrasound, traction, etc., etc. In some cases, in one prescription form I have seen, in pad I have seen, doctor, please tick whichever is necessary. So it is a pathetic situation where a physiotherapist is going to a medico and giving his prescription pad and begging for a prescription. Patient behaviors and reactions are very dangerous. Please be very aware while you conversing with patients. They will pull words from your mouth or they will just use your words. And if anything goes wrong, they'll put all your blame on your head to a medico or to anyone else. Relationship with patients and team members, you should maintain professional relationship. Emotional stability is very important. Please don't forego your self-esteem. Be patient. Don't expect positive situation always. Some patients will give results. Some patients you may not get results. Some patients will give respect. In some patients you may not get respect. It will take time for you to get respect and results. As experience grows, your brain grows, your skill grows, everything will come to you. Listen thoroughly and react softly to patients and to your fellow medical professionals. Wait for your chance to prove. Avoid unnecessary dialogues. Respect the hierarchy. No slavery here. You should always respect a medico or a fellow professional or other healthcare professionals, but don't become a slave to them. Only knowledge and skill will protect you and it will take you to the next level. Performance is the best investment, nothing else. In clinical practice or in a medical practice or in your professional, in any type of profession, in any type of practice, performance is the best investment. WCT advocates for health insurance reimbursement models that do not require the referral of a medical practitioner before a patient client may seek the services of a physical therapist, give boon to our clinical practice and profession. And it also advocates and encourages the direct access concept. All countries, states, departments should start advocating, promoting direct access of patients to physiotherapy. So what is expected from our associations, councils, etc., education standard? It has to be standardized. Now, council has come. We have one nation, one syllabus. That is a great achievement and is a wonderful moment to standardize education throughout India. Medical Council of India given a syllabus. A dental council, one syllabus. National Nursing Council has given syllabus. Every profession has given syllabus to their profession. So now we got our syllabus from our council, though there are some, hopefully it will be upgraded. Still, it has to be upgraded and it will be upgraded in due course. But it is wonderful syllabus, wonderful system now we got through our council. There are some plus minus. Hopefully, it will be rectified sooner or later in due course. But now we are happy what we got now. Salary structure should be improved, uniformity should be there. It is very poor and pathetic to hear that 12,000 rupees is the salary for a government contract physiotherapist in Tamil Nadu. So these type of inequality, disrespect should be rectified from administrative powers, from administrative level and legal level. Physiotherapists should get administrative posts like medical officer, and there are posts available like registrar, deputy registrar, controller of examinations, etc. in government universities and government sectors. Of course, in private deemed universities, physiotherapists have become a registrar. Even it is a proud moment that our physios like Dr. Annamalai sir and Dr. VP Ashok sir have become vice chancellor and registrar, and deemed university in government setup. And in deemed universities, there are many fellow professionals and senior people become registrar, dean, etc. in our. But legally, we should be eligible, or we should be made eligible in administrative sectors in government side, and we should have legal value and safety doing professional practice. So develop your own strategies, look and behave professional and unique. You should look very professional, be conscious and aware what is happening, who know overconfidence, update yourself, have emotional stability, identify your strength and weakness, be healthy and fit, be creative and constructive, never give up at any situation. You all should become entrepreneurs. Don't fix yourself as a successful clinical practitioner or a academician or researcher. Try to become an entrepreneur where you get more money, more fame, more name, where the profession will be taken to the next level. The future of neurological physiotherapy is post-head transplant physiotherapy. After transplanting the head, the physiotherapy is going to do a wonderful role by making the limbs to move or the patient to walk and become productive. And the meaning of the surgery and the result of surgery is based on the patient's activities of daily living. So the head transplant surgeon told physiotherapist will take care of the movements. We will just replace the head. Rest they will take care. So this is the highest moment, pride, demand which is kept on our profession. We have a wonderful suggestion or request to my dear fellow clinical physios. Have a good clinical setup. Don't give prescription pads to anybody to refer patients. Try for first contact practice. Update your knowledge. Survival of the fittest is the current scenario. Know your boundaries. Dear students, please upgrade your knowledge and skill. Be committed while you are a student. What makes difference between man and man? It's commitment, nothing else. As told by Swami Vivekananda. My take-home message is add knowledge as prefix and skill as suffix. Instead of putting doctor, friend, and in the back PT, I suggest you go for knowledge and skill as prefix and suffix. If you have this, naturally, literally, the doctor prefix will come to you. So let us commit ourselves to care and to cure the ailments with utmost responsibility. Thank you very much for this opportunity to the entire IAP team, and thanks for the moderators and for the coordinator. And thank you very much, catch me at raghavphysio.com. Bye-bye.
Thank you so much, sir. Thank you so much for the wonderful insights in direct access and physiotherapy. Actually, you have explained about the do's and don'ts which you have to follow and follow for the future practice, which is truly the need of the hour. The session provided is very clear and comprehensive understanding of how to assess and treat the physiotherapy perspective. On behalf of Tamil Nadu IAPWC, we extend our heartfelt thanks to IAPWC for giving opportunity for this impactful webinar series. Wishing you all a very happy World Physiotherapy Day, and let's continue to learn, evolve, and empower others to recover faster. Thank you once again. Thank you, sir.
Yes, thank you.